This lecture is going to cover the air polisher. The air polisher is an air-powered device that delivers a mixture of water and sodium bicarbonate or aluminum trioxide powder, and we'll learn which powder we should use when. So it's going to depend on our patient's medical history. And air through a handpiece to the tooth surface. So it's basically like a little like sandblasting. So this is a picture of an air polisher. Looks a lot like our Cavitrons. So it's going to be very similar to that unit, but it's going to remove less enamel than our rubber cup polishing. Okay, the problem is these machines get gummed up. They're a little bit harder to keep clean. So a lot of times we'll just use our rubber cup polishing instead of using the air polisher. The air polisher, though, I will say is fantastic if you have a patient with braces. So if you've polished a patient with braces yet, you've realized that it's really difficult to get around those brackets where it's much easier with your air polisher. So what are some contraindications? So if a patient has a restricted sodium or salt diet, then we have to use the aluminum trioxide. So we can't use the regular powder. So that's when the aluminum trioxide comes into the mix because it doesn't have any salt in it. If a patient has exposed or sensitive cementum or dentin, we're not going to use the air polisher. If they have areas of hypersensitivity, okay, unless the patient's numb, then we're not going to use the air polisher. If they have very inflamed or sore gingival tissue, then we're not going to use the air polisher. Why? Because it's going to be like sandblasting on that sore tissue, and it's going to be very uncomfortable for your patient. If the patient has composites or precious metal restorations, you do not want to use the air polisher on those. But now in your Wilkins book, there is a chart that says it is okay now to use it on gold restorations. Okay, if the patient has an infectious disease, obviously we don't want to make that an aerosol, so we're not going to use the air polisher. And if they have renal disease or metabolic disorders, we're not going to want to use the if a patient is immunosuppressed, we don't want to use the air polisher on them. We don't want to use the air polisher on primary teeth. Remember, primary teeth are not as hard as our permanent teeth, right? That's why they're whiter. They don't have as thick a layer of enamel. Okay, so we don't want to use it on our primary teeth. If you think that the tooth has a cavity or caries, so we're not going, or if the patient is high risk for caries, we're not going to even use the ultrasonic. Now, as far as implants, it's kind of controversial whether you should or should not use them on implants. So I would just check with the, or just make sure that it's fine with whoever placed that implant if an air polisher can be used on it. And if a patient is using diuretics, so those are like water pills, or if they're on long-term steroid therapy, and if they're on long-term steroid therapy, and we'll learn this in pharmacology, they don't heal as well. So if you have a patient that is on a water pill or doesn't heal as well, you're not going to want to use the ultrasonic scaler. Now, what are we going to use it on? So we're going to use it on a patient with heavy stain, poor OHI. Now, I know that sounds a little tricky because if they have really inflamed gingiva, we can't use it. So you're going to have to find the right patient. So a lot of plaque, but the tissues can't be too like swollen and inflamed and bleeding. We also like to use it for preparation for sealants. So it's great to prepare to clean the tooth before we do a sealant. We like to use it on the margins of crowns and bridges. And if patients have ortho. And remember, now they say that it might be okay. Wilkins says it is okay to use it on gold. Okay, so how do we set it up? So it needs electric, it needs water, and now it needs air. So it needs an additional hookup that we didn't have with our ultrasonic scaler. So you're going to turn the unit on, and again, we'll walk through this in clinic so you can see it, but I'm going to talk about it in this lecture. So you're going to turn the unit on, and you're going to let the excess or residual powder come out of the unit. So it's going to kind of like puff and blow out of the unit. So you're going to leave that on for about 15 seconds. Okay, flush the water line for 2 minutes at the beginning of the day, 30 seconds between patients. Again, that is if you have city water into the units. We are self-contained, so that doesn't pertain to us. So our units, we change the water, we dry the lines. Okay. So now after you've done all that, turn the unit back off. And you're going to fill the powder chamber up. So you're going to open up the dial, you're going to place your finger over the hole in the middle of the chamber, and you're going to fill that chamber with your powder. Then you're going to put the reservoir cap back. You're going to turn that unit on. You're going to attach the nozzle. Okay. You're also going to let the water fill up in that handpiece before you drop that nozzle down in, just like we learned with our MagnaStrictives. You're going to bury it in the unit, but we're going to have it inside the drawer so less aerosols get on it. You're going to bury your handpiece, and you're going to bury your insert. As far as PPEs, we're going to want to make sure that we wear our appropriate PPEs just like we would with the ultrasonic. And you're also going to make sure that your patient has done their pre-procedural rinse. As far as positioning, the operator and patient is going to be very similar to when you're doing your regular polishing. So more of those fundamental positionings. How do you do it? You're going to retract that patient's lip and cheeks to form a cup. Again, just like we did with the ultrasonics. You can also wet some gauze and place it over the patient's lips, or you can coat the water with or coat the with a little bit of lubricant. Why? Because again, that's like that sandblasting, and it kind of hurts when it bounces off the tissue. Use the HVE if possible when not using the jet shield, and I'll show you how to set up the jet shield and how that makes it different than using it without a jet shield. Okay, so technique without the jet shield. So you're going to position that nozzle of the ProfiJet approximately 4 to 5 millimeters from the tooth surface, and these are your recommended angulations. So please look over those and know your angulations without your jet shield. So for your anterior teeth, it's going to be a 60-degree angle to the tooth. Your posterior teeth, it's going to be an 80-degree angle to your tooth, and your occlusal surface is going to be a 90-degree angle to your tooth. You're going to adjust the control on the top of the reservoir on the cap to make sure you have just enough powder. So again, you're going to find that happy medium. So it's going to be enough water and enough powder. We call that kind of a slurry. Okay. So high is going to be like that 12 o'clock position, and that's going to be for your heavy stain. Low is going to be more that 6 o'clock position, and that's going to be your lighter stain. And some of the newer models adjust the powder with a knob on the unit. So it just kind of depends on, you know, what unit you're actually using is how you adjust your powder. You're going to use a rheostat, just like you would regular polishing, just like we learned with the ultrasonics. So again, use it with your non-dominant foot. This rheostat is a little bit different in that it has 2 positions. So if you push it down halfway, it's going to give you just water. If you push it down all the way, you're going to get what we call that slurry. So it's that water powder mix. So what's great about that is you push it down all the way and you're air polishing, you let up to halfway and you can rinse that area. So just like you would rinse your Profi paste off, that's how you rinse this gritty powder off. Okay, center the spray on the middle of the tooth, and then you're going to use constant little circular or scalloping motions, always keeping that nozzle approximately 4 to 5 millimeters away from that tooth. Okay, clean 3 to 4 teeth at a time and then rinse. Okay, so you're going to clean 3 to 4 teeth with that rheostat pushed down all the way. You're going to then back it off so it's only down halfway, so now you're getting only water, and you're going to rinse those teeth off. Now, if I use my jet shield is going to look very similar to a Profi cup. So it is going to do the angulation for you just like it would if you were using a Profi cup. And your suction is going to hook up to this jet shield as well, so that's going to remove your aerosols. So if you're using a jet shield, you're just going to apply that Profi cup, looks just like a Profi cup, on the middle third of the tooth with very light pressure. The jet shield is going to remove 97% of aerosols. So if you're using it on a patient without ortho, I would highly recommend using the jet shield. If you're using it on a patient with ortho, the jet shield kind of defeats the purpose of making it easier, right? Because now you're just back to where you're almost rubber cup polishing. So you're going to pivot that nozzle inside the cup to adapt to all areas. Again, very similar to rubber cup polishing. You're going to apply that spray for approximately 2 seconds for each area of the tooth. So once the mouth is done, it's post-appointment, so it's time to break down that unit. So you're going to clean and disinfect the unit, the hose, and the handpiece. You're going to remove that nozzle from the handpiece, and you're going to clean it with this little wire tool that it comes with. You're going to place that nozzle in the ultrasonic cleaner, so this one can go in the ultrasonic cleaner or just autoclave it, but you have to make sure that that cleaning wire stays in while you autoclave it. Why? Because there's still going to be little pieces of powder in there, and if you autoclave those, it gets really hot. It's going to bake that powder in, and it's going to close up that hole in your handpiece. Okay, so bag that nozzle for sterilization. Okay, then turn off your unit and wipe it all down. So you're going to remove the powder, so you don't ever leave powder in the chamber. So you're going to take that powder reservoir and you're going to pour it back into the jar. It does not backflow, so it is still clean powder. Okay, it has valves in it that can only allow the powder to go out. Nothing comes back in. That's why it's safe to pour it back in the jar. Then you're going to take your HVE, a clean HVE, and you're going to remove any residue from down inside that chamber. You're going to turn that unit back on and let the residual powder expel out into the air. So it kind of poofs out, and you're going to let that run for about 15 seconds. Okay, you're going to clean the O-ring around the cap. You're going to clean the area under the powder control valve, and then you're going to put the lid back on. So basically, you're just going to try to remove as much of the gritty powder as you possibly can without getting the inside of that chamber wet in any way. It needs to always remain dry. Okay. You're going to flush those water lines. You're going to remove all water, and you're going to leave it dry, right? So you're going to dry these lines just like you would with the ultrasonic, just like you would with the air water syringe. We never leave water inside these units. So disinfect it and then return it to the mobile cart. So the air polisher is a great way to polish. Some patients love it, some patients hate it. But I think the best time to use it is when you have a patient with ortho. It just makes cleaning around those brackets much easier.